Antibiotics are used very ubiquitously in the medical environment and establishments, and for good reason. They have been very effective at managing infections and treating infections, so there's definitely use for them. At end of life, though, we really need to question their efficacy and whether or not it's something you really want to be part of a treatment plan at end of life, because at end of life we're looking at comfort measures. We're going to get into that today. We're going to talk about when you shouldn't really be using antibiotics at end of life and why, and in the small number of cases when you can use antibiotics and why you would actually use them in those cases. I'm Abigail. I'm here to normalize conversations and education about death and dying so we all die better at end of life. Let's get into it today. So many of us have probably used or had access to an antibiotic at some point in our life. Usually kids get things like ear infections or things like that, or maybe you had an eye infection, maybe you had a UTI, maybe you had an STD, whatever it is. Maybe you had an infection and you took an antibiotic for it for a certain period of time. Hopefully you finished the antibiotic and took all the pills, all the capsules, whatever it was, because when you don't, there are issues with that. That's a topic for another day, maybe another channel. At end of life, though, just as a quick reminder, we are focused on different goals. Our goals at end of life are to really establish and maintain and manage comfort and the holistic part of this person that is dying and their family. So antibiotics typically at end of life are discouraged. The reason why they're discouraged mainly is because they cause more issue than benefit. And what I mean by that is usually it's something like when you take an antibiotic and your body can't use it effectively, you have to remember that in order for medicines and these interventions to work effectively, your body has to be healthy enough to use them. And to use them effectively and efficiently. So at end of life, we are really looking at comfort measures only. We're no longer pursuing curative measures because it has been determined that this person has a very limited life expectancy, and the goals are really centered around comfort and managing comfort and for the patient and for their assigned family. Okay, so we got that quick reminder there. And with that said, when we're doing certain interventions to work with the patient and maintain the comfort for the patient, antibiotics aren't usually part of that. I will be talking about in the cases when you do. But generally, for the most part, patients at end of life are already dealing with a very weakened immune system. They're already dealing with multiple organ failure that is just going to progress with each coming day. So not only are they not able to really make use of the antibiotics and use them effectively, the side effects of the antibiotics are more common and seem to almost cause more distress than benefit. And what I mean specifically by that, it's usually things that involve the gastrointestinal tract, usually things that cause a lot of stomach upset, a lot of cramping, a lot of diarrhea, maybe a little bit of nausea, especially if that person can't eat enough or they can't maintain a good oral intake. Sometimes with antibiotics, you have to take enough, take them with food, something substantial so that they don't, cause any stomach disruption. But especially for people who have already been sick, they probably most likely have had some kind of antibiotic therapies. And so when you do repeat antibiotic therapies, particularly for an infection that is pretty persistent and then for infection that, keeps coming back, you can develop resistance, and then you develop certain super infections, which are like C. difficile, a very common and very annoying type of gastrointestinal infection that causes a lot of diarrhea. It has a certain smell, and it can be extremely uncomfortable, not only from a gastrointestinal standpoint, where it's causing cramping, it's causing a lot of dehydration, especially in somebody, again, at end of life. People are usually already dehydrated, and they're probably not even taking in enough fluids or food anyway because they're dying, which that's a very normal thing. I want to remind you, when we're dying, we're not out there running a marathon. We're dying. So we're going to have this natural expected decline that we see with everybody. So those things are normal. But when you add in something like antibiotics to try to treat some kind of infection, then what you're doing is you're usually adding to side effects of medications and adding to the discomfort. And mainly the discomfort with antibiotics discomfort related to antibiotics is usually related to gastrointestinal upset, cramping, stomach upset, diarrhea most likely, and then things like super infections where you get like C. diff. And C. diff is extremely contagious. You have to use protective clothing, protective measures, making sure you use a gown. If you get it anywhere, even in the house, it sits on a surface and you accidentally wipe it and put it in your eye, your mouth, or whatever, and you're eating something, it is extremely contagious. So you really want to make sure that, things like, the person's room is really sequestered from the general eating areas, things like that. You have really good hand washing if you're dealing with a case like that. C. diff infections are very tough to treat. So you don't want to get there in the first place. So usually avoiding antibiotics at end of life are really good. We know their efficacy is not that great at end of life. We know they cause a lot of GI upset for the most part. And so they contribute more to discomfort and other type of uncomfortable symptoms at end of life. And not only that, you can manage symptoms for infections in a different way. So say, you have somebody that has pneumonia, and usually, where, in the past you treated with antibiotics, but at this point we've determined this person who is dying with pneumonia is at end of life. We really want to keep them comfortable in the home, in their assigned home, and keep them as comfortable as possible. You can do many things. You can do things like nebulizing treatments, which are breathing treatments, an inhaler, things to keep the lungs open, the breathing tubes in the lungs open, keep the mucus down, the congestion down, use some other drying agents, use other type of cough medications to suppress the cough so they're not constantly coughing, but then you're using drying agents to make sure that all the mucus and congestion are being dry. Maybe give a diuretic if it has to do with some heart failure issues with fluid buildup. And you can do things like an anxiolytic, something like an Ativan, some type of, benzodiazepine, give them a little bit, and or give them a little bit of morphine. And again, if you watch my video on morphine, I do dispel those kind of concerns, or really dispel the myths around morphine. Really, morphine, particularly when it comes to the pulmonary system, it really does help you breathe with more ease. It opens up the blood vessels, lowers the diaphragm, and you actually can breathe more comfortably. And I'm not talking about snowing somebody with medications to make them go to sleep. No, what I'm talking about is giving small doses in a methodical manner with physician-ordered a course and physician direction and direction by your medical team to keep someone very comfortable, breathing comfortably, to the point hopefully where they can even enjoy a simple drink that they like or enjoy a food that they like, for example, because we're really focusing on quality of life. So those are things you can do to actually manage an infection. You treat, anything that's around the discomfort, whether it's pain, anxiety, whether it's fluid buildup, things like that. There are medications that you can use to really manage those. In the cases where I actually found antibiotics useful and where I did find a good reason for them in hospice and palliative care, usually were only one type of infection that I really found useful and just to try. And those usually were for UTIs or urinary tract infections. And the only reason I bring that up is because I don't want people to think I'm here saying, don't ever use antibiotics when you're at end of life at all. There's no efficacy at all. No. First of all, you have to follow what your physician says. I'm very clear here on my text here in the about section on this page. This is not considered medical advice. This is purely educational. But I want to share with you, and I want to give you guys the information and awareness of what happens in this field so that you can all die better at end of life. So this is just education. But I found that most antibiotic use is really futile and doesn't really do much, in the exception of urinary tract infections. I have found them to sometimes, most of the time, depending on the case, can be useful in helping with the discomfort of the urinary tract infection. We're not focused on trying to get rid of the infection, but Treating a urinary tract infection is usually a little bit on the simpler side. You can give them a loading dose of an antibiotic, and usually you're on antibiotics for just several days. Usually it's under a week. Usually, again, everything is individual to the person and the case and the diagnoses and other conditions. But usually what I found is it helps with the discomfort, it helps with the pain. UTIs can be very uncomfortable. I don't know if you've ever had one, but they can be very uncomfortable and they can elicit a lot of pain. Now, that's not the only way you can treat pain with a UTI. There are a lot of anesthetic type of pills that you can take. You can take Azo, and you can take the prescription strength, following doctor's orders, of course, and that is good. Now, if you're already dealing with a lot of pill burden, though, someone who already has pills and it's too many, that they already are dealing with some pill burden, meaning that there's just a lot that they're taking, maybe instead of that, then you can do something like sublingual type of medications, or medications given through a suppository through the rectum to help them with their pain, to help them with their anxiety, things like that. But usually the only time I've really seen the antibiotics work and worked effectively, things like UTI. But for everything else, and even with UTIs, you still have to be very careful because, again, an end of life, especially in someone who's used antibiotics frequently throughout their medical history, the bowel and the gastrointestinal ramifications are just really tough to deal with, especially if the person who has taken antibiotics for a long time develops a Clostridium difficile infection, C. diff, because it is such a tough and very contagious type of infection to deal with. So let me know if you have questions. I can imagine that especially for people who are used to taking their loved one or going themselves to the doctor over and over and getting antibiotic treatment, that thinking of stopping any treatment, let alone antibiotic treatment, is tough. But again, this is all in the context of end of life, so we really have to look at doing things differently. And I can imagine that doing things differently can elicit a lot of anxiety because, first of all, it's something different. You're used to doing one thing and then you're doing something different. Then now you're thinking like, well, if I'm not treating with a medication, if I'm deciding that if the doctor's giving me an option and I'm deciding not to treat with this medication, am I failing at being a good child for my parent who's dying, or a good caregiver? And no, you are refocusing and reframing the goal of the treatment plan, which at this point at end of life is comfort. So let me know if you have questions. Let me know if I didn't cover anything. Clinicians out there, if I missed something, pop it in the comments. I read every single one of them and make sure to respond. And if I need to do an addendum, I will, or add it, discuss it in the comments, whatever it is to get the information out there for you, because I'm here for you. Love you all. Talk to you soon. Take care.